When we suffer any kind of infections, either bacterial, viral, or fungal infection in our body system, then why temperature of the body rises? Why fever occurs? Fever is a defense mechanism to kill the pathogen that has entered inside our system. At high temperature, cytokines act better on the pathogen to kill that. That's why fever occurs in our body. Then how does fever occurs? Normal temperature of our human body is 98.6 degree Fahrenheit, and let's suppose you get any bacterial infection, then your temperature becomes, let's say, 204 degree Fahrenheit, 104 degree Fahrenheit. So how does your temperature of the body rises to 104 degree Fahrenheit? These cytokines that are released from white blood cells are circulating in the bloodstream, and it goes and act on the hypothalamus, and it raises the temperature set point there to 104 degree Fahrenheit, let's say. Then hypothalamus commands the body that we should increase the temperature of this body to 104 degree Fahrenheit. Then your body needs to generate that much heat. Then how can your body generate the heat? For that, peripheral vasoconstriction occurs. There are peripheral circulations on the hand, on the feet, legs. So these blood vessels constrict to prevent the heat loss to the surrounding. And when blood vessels constrict, you will feel cold, that we call chills. So you feel like having cold, and when you feel cold, what will you do? You will put more clothes, you will wrap yourself in blanket, and in this way you prevent heat loss. So if you prevent heat loss, you will generate heat inside your body. So this is the mechanism of heat generation to raise the temperature. And another way of heat generation is shivering, that we call rigors. So when skeletal muscles contract, it generates heat, and it raises the temperature of the body. So these are the mechanism of increasing the temperature of our body. And increased temperature is required to kill the pathogen successfully. But your body cannot maintain that high temperature for a long time, and it drops again to baseline. So why it drops again to baseline? How does it drops to baseline? So your body temperature is now, let's say, 104 degree Fahrenheit. Then you have to lose heat to the surrounding to again let the temperature become 98.6 degree Fahrenheit. So one of the mechanism is sweating, diaphoresis. So when you sweat a lot, it dissipates heat. So that's why in fever, in high fever, sweating occurs, night sweat occurs, right?